Hello, good afternoon, friends.
Sorry.
Hello, good afternoon, friends. Today we have an interesting case. He is a young boy who had got multiple session of body hair transplant for his advanced baldness. He is almost grade 6 to grade 7. The main problem that we are having is lack of donor hairs to cover up the entire scalp. We have already done up to the mid scalp crown level. The slope has to be covered, which we are not having the adequate number, so we are trying to cover it up with scalp micropigmentation. So what is scalp micropigmentation? It's just deposition of pigments which is almost blackish brown in color in the dermal levels, which mimics hair dots. They are not hairs, they just mimic a hair from distance. So if you have some existing hair and the micropigmentation is given nicely, then it looks as if the whole scalp is covered. So as you can see, we have covered the front, from front to the almost slope, the crown area which is extending slope area. From here onwards, there is at least 5-6 centimeters which is empty, and we don't have adequate donor hairs. As you can see, the scalp, the donor has been harvested and is also looking very sparse. We can also add density with micropigmentation in the posterior scalp area from where the hair has been harvested. So scalp micropigmentation is helping us in two ways. One is to cover up the empty patch of scalp which has not been covered by body hair transplantation. Second, it can also give density to the donor areas where we have already extracted hairs. It can also be added to give density in the transplanted area in between. So the growth is not complete, it's just a initial. This third session is around just 1.5 months back, so we will be expecting much more growth in this region. So we are not touching anything here right now. We are just touching the empty area, that is from the slope onwards. So this is the dot-like structure that's just given at dermis level, and this is the pigment. Pigment has to be very high quality so that the spread of the pigment is minimum. Otherwise, if the metallic contents are high in the pigments, then this pigment spread in the dermal layers and they don't stay like a dot. They look quite diffuse, and that's not natural. It takes time because we are going area by area and we are putting dots covering that particular area. The patient does feel a little bit of pinching pain, but that's totally comfortable. It's better than a tattoo that the patient gets. So the comfort level is quite okay, and compliance of getting this SMP is also very nice. So we have almost covered up one of the part of the slope. As you can see, they're almost looking covered like a hairs. So in between we do have hairs, so pigmentation will not look that unnatural. So now we'll come to this segment. Yeah. So depth is around 2 to 2.5 millimeters. We don't go below that. Depending on where we get that little punctured bleeding. That's the end point. We don't go beyond that. If you stay very superficial, the pigment doesn't last. If you go very deep, the pigment will not get deposited, it will be eaten away. So it has to be at a very particular depth so that the result is lasting. We hope to get the results to stay for 3 to 5 years. But again, it's variable. It doesn't stay the same way in all patients.
So, Sagar, are you okay?
So hair transplant in bald patient is a very difficult problem. It's a long drawn process. In spite of transplanting good number of hairs, as we age, there is a thinning of the hair, the density decrease. So we need some additional things to restore the natural and fuller look. For that, SMP is a very good procedure. So this is a motorized SMP device. The needle that is insert is going below the skin level, that is going to the dermis level. There is not a single needle, they have a group of 3. Okay, so group of 3 needle is just like this, and they are going into the dermis level and coming out like multiple pushes. So that deposits this pigment at those 3 dot-like structure. Okay, so there the 3 prongs are going like this and coming out, going like this and coming out.
Sir?
Okay, so we'll leave you here. I hope you have enjoyed this whole procedure which we have demonstrated, and please come back to us with queries if you have any. Thank you so much.